There was a period of time where I had tried REZUM some years ago, and my initial impression compared to the tuna, which takes about 15 minutes to do, my initial impression is that patients had a few more symptoms during the procedure itself. I was used to people just chatting with me during the tuna, got a sense that it was a bit more painful. I also got a sense that there were some more urinary symptoms when the catheter would come out. And my initial impression was, and it was 3 or 4 years ago, I was very happy with the tuna. Why change? And I suppose I didn't mind being considered a bit old-fashioned because I was very comfortable with the tuna. But what happened over time really is the tuna got fewer and fewer urologists doing it. And I even started to get some questioning from insurance companies with regards whether it was an experimental treatment because they hadn't heard it. It's no longer part of the American Urologic Association guidelines. And this caused me to really look more deeply into the REZUM. And I went into it from a different vantage point the second time around, thinking I'm going to do this. So rather than let me try it and see, it was let me try it, let me perfect it, let me do it in a manner that I think is best for the patient and modify things so I think it's just as good or better than the tuna. And what I mostly did there is change very much how I numb patients for it. I made a modification that I'm not sure anyone else is doing, and it made an enormous difference. So my main impression that got me to go back to the tuna has now really been solved. And in fact, I'm in some conversations with the company of recording an educational video on how I do that local, how I apply the local. And I'm very pleased with that, and I think my patients are too. So by the way, a REZUM only takes me about 1 minute. So even if you felt it a little more, it would probably be worth it for 1 minute. Now that they don't feel it much, it's an obvious improvement over the tuna. Secondly, I didn't want to change. If I was going to switch from the tuna to the REZUM, I didn't want to switch the fact that I only have a catheter in for 2 days, which is a very manageable period of time. In fact, some patients say it was easier during that period of time because they didn't have to urinate all the time. The REZUM folks, I think the standard is to leave the catheter in 5 to 7 days. But I insisted on keeping it at 2 because I wanted to be able to say that this is an improvement for my patients over a tuna. And I felt as if I was leaving the catheter in longer, that's not so much of an improvement. In the beginning, I didn't know what to expect. There are more urinary symptoms in some people, burning a little more, a little harder to urinate at first. But I've gotten around that now. Just as with the tuna, where there was a point where I wasn't that experienced, I'm very experienced with REZUM now. I know what to tell the patients. With everything, as long as the patients know what to expect, it tends to make a huge difference on their perception of how things are. It's rare that someone can't urinate afterwards. Sometimes we'll teach you how to catheterize yourself, for instance, for a day or two and nurse your way through it. So we have found great success now with patient expectation, knowing what to expect so there's no fear, and teaching some patients how to self-catheterize. So we've kept things at a catheterization time of 2 days, which I think is almost unheard of in most practices. And suddenly the 2 trepidations I had, more symptoms, more trouble urinating, more discomfort, have really gone away now. And it really just makes the REZUM a no-brainer. I believe the success rate probably is higher than the 78% that I quote with tuna. I still quote that though with REZUM. I always try to manage expectations, but our results have really been better than that so far.